Please go ahead, ma'am. We are live now.
On behalf of ASSOCHAM and the Cancer Foundation of India, it's an absolute pleasure for me to welcome you all to today's session. Well, January is the Cervical Cancer Awareness Month, so we took this opportunity to reach all of you. Every 8 minutes, one woman in our country loses her life to cervical cancer. By the time we'll be done with this session, we would have lost 11 lives. Cervical cancer is a reality for women in India, and so are the deaths. Many of us may not be talking much about this preventable cancer, but we need to build more and more conversations around it. And in the next 90 minutes, you will hear a fantastic panel of experts covering the key aspects of cervical cancer prevention. But to get us started, we are pleased to have with us Mrs. Upasana Arora, Co-Chair, ASSOCHAM National Empowerment Council and Chairperson, Yashoda Super Specialty Hospital in Delhi. She is a leader in her own right who has been recognized widely for her contribution to the healthcare industry. An alumni of Kanpur University, she is the first Indian to be awarded the prestigious fellowship of the International Society for Quality and Accreditation. She's a mission member of a healthcare mission and holds an international fellowship on health technology assessment from UK, among many, many honors. Ma'am, thank you so much for your time. Over to you.
Thank you, Sutapa, and thank you, ASSOCHAM and Cancer Society, because it's a very important topic today. And I am thankful to all who has joined here, and thankful to those also who are going to listen to this very dynamic panel, because cervical cancer is the fourth most common cancer in, if you see, especially in females. And 27% of world's cervical cancer is in India. So for Indian females, it is very important to know about when to get vaccinated to their female child, how to go for screening, when to go for screening, how to prevent this cancer. And I will not take much time because we have an expert panel here who are going to address on this. And it is going to be really, really helpful, because today is a very special day also. Today is a Girl Child Day, and we are talking about cervical cancer. So it's actually a very important day, and we are going to talk very important topic also. So over to you, Sutapa, so we can start.
Thank you very much, ma'am. I think you set the tone for the evening. Yes, the girl child is important, and so are the mothers of the girl child. I think we have to think of both of them, because if the mother is keeping fine, then the child will do well as well. Thank you very much, ma'am. And to get us all supercharged this evening, we're extremely honored to have a very special person with us today to deliver the keynote address, Mrs. Lakshmi Puri. Well, I have to really make your achievements brief, ma'am. So 15 years at the United Nations. She is the Assistant Secretary General of United Nations, Deputy Executive Director, UN Women, and Ambassador. Mrs. Puri is an Indian diplomat of 28 years who joined the Indian Foreign Service in 1974. She was India's ambassador and has represented our country in Hungary, Japan, Sri Lanka, Switzerland, Bosnia, to name a few. As a celebrated officer of the Ministry of External Affairs, Government of India, she held sensitive positions and negotiated many bilateral and multilateral economic diplomacy initiatives for our country. What an honor for us to have you with us, ma'am. I request you to kindly address the audience.
Thank you, Sutapa, and thank you, Upasana ji. And I'm very, very privileged to be part of this, as Upasana ji said, a very important initiative that ASSOCHAM has taken. And I want to thank them for giving me this opportunity to speak on this critical, but as you all have said, a much neglected subject, cervical cancer control, a comprehensive approach. But may I amend the title a little here to add elimination, because the happy fact about this project is that it is mission possible. At a personal level and as a women's rights advocate, I'm very happy that you are organizing a webinar on a women's non-communicable disease, which is often neglected again. An important area that needs advocacy on a global platform, but also within India. As Upasana ji said, we have 24% of the world's cases in cervical cancer. So we really need to focus on it and give it our all in order to get progress. Now, in 2020, if you're looking at the incidence, I know you've already mentioned this, but just I think statistics always, ginger up the attention. So GloboCan has estimated that 604,000 women were diagnosed with cervical cancer, and 342,000 women died from the disease, and about 14,418 new cases of invasive cervical cancer will be diagnosed, and 4,000 women will die from cervical cancer. So this is the kind of statistics we are looking at. And as you already said, in every 8 minutes, and you put it very well, Sutapa, one woman dies of cervical cancer in India, and that this mortality is avoidable, not inevitable. So what are the challenges? Over the past decades, incidence and mortality rates of cervical cancer have declined in most regions of the world, but the battle is not won unless we are able to prevent, immunize, diagnose, and treat all women and girls at risk. And in India, the challenges are greater because they are of creating and strengthening in the infrastructure and services and reaching all women and girls in urban and rural areas and in disadvantaged communities, and for them to come out and claim these services. So we need to have a multi-pronged and a comprehensive, and I therefore like the word comprehensive, health and social intervention approach. Now, why the focus on cervical cancers? You have referred to them, both of you, but there are 3 reasons. First, it is one of the common cancers, and if we could conquer it, it would give us strength and motivation to eliminate other forms of cancer. When you conquer something, you feel emboldened that, yes, we can do it. Second, it is part of solving a grossly neglected public health problem that potentially affects half the population of a country, since it is the 4th most, as was mentioned, 4th most common cancer affecting women globally. Third, and this is important, as I said, for me particularly, it is a women-specific non-communicable disease, and hence the fight against it is also a fight for women's right to health and freedom. And as was mentioned by one of you in the beginning, it's also about wellness, and they're prioritizing that wellness. And freedom from unnecessary suffering, this brings uniquely to women and girls. So now the global strategy. What does a comprehensive war against cervical cancer involve? We have experts from different fields to give you a perspective, but let me give you a little bit of the global United Nations conversations and perspectives that have been happening. When I was with UN Women, we worked very closely with WHO and Gavi and UNITED to focus on women's health issues, which are, again, globally, they are, neglected. And this was one of the causes that we supported from 2015 onwards. On 17th November 2020, the WHO and other partners with 154 member states, including India, launched a global strategy to accelerate the elimination of cervical cancer. And it was hailed, and it was in the midst of COVID, hailed as a historic milestone. It envisages 3 key steps. screening and detection, prevention through vaccination, and prompt treatment to those affected. It's at 3 targets, the 90, 70, 90. The first target, 90% of girls fully vaccinated with HPV vaccine by 15 years of age with support from WHO and Gavi Alliance. Many low and middle income countries have introduced HPV vaccine in the last couple of years. The WHO recommends a 2-dose schedule for both vaccines for 9 to 13 year of age girls and a 3-dose regimen for 13 to 15-year-old girls. The second target is 70% women screened through high performance test by 35 and then 45, because these are the more vulnerable, is the vulnerable age. The third target is 90% women affected pre-cancer treatment and those with invasive cancer matched. So, given that, I would like to propose that, I always like to draw upon our Indian Hindu kind of, symbolism. So I would like to propose what I call the Sapta Sahasraras of action, or action generators. So what is required for this strategy to be implemented, especially in India, is that if we want to achieve our dream of a cervical cancer-free world and worship or upasana, and no pun intended, Upasana ji, then the following 7 sahasraras or energy and action generators must be installed and activated. Now, the first one includes to make sure that this global strategy that India is part of, other countries are part of, that is, and targets are included in India's health strategy, policies, and programs, including for women's health and national immunization programs as a priority. The second is you have to invest the necessary resources at all levels by concerned entities, both public and private, because it has to be a public-private partnership. It cannot be done just by the government. Third is set up the required ecosystem of medical, pharmaceutical, testing, vaccination infrastructure, tools, and personnel, and make it a part of regular annual health checkup of women, which, by the way, is itself lagging in India due to hesitancy and mindset of not going to the doctor or checkup until a problem arises and not prioritizing women's well-being and health. So in the case of cervical cancer, it then becomes too late. So then the fourth is build a data and evidence-based knowledge hub in India to inform and drive strategy. Then the fifth is undertake awareness raising, advocacy, and movement building to change mindsets about its necessity, safety and effectiveness and benefit, and get communities to embrace the strategy using innovative approaches. Sixth is to map and bring together successful models of multi-stakeholder collaboration. And I think this is what you are all trying to do through getting together this panel and this webinar series to get all the actors who can possibly collaborate. And this includes, of course, governments at the center, state, and local levels. These are all levels are important. The private sector and their associations like ASSOCHAM involved in production and supply in healthcare systems, providers, workers, schools, and colleges and communities. And I know you have all of them represented in these panels. But last but not least, showcase global and Indian best practices, replicate and scale them up, because nothing succeeds like success, but also nothing inspires like success. Then I think there has been a lot of literature generated, evidence-based literature generated of the economic and social benefits of eliminating cervical cancer. And there have been, several studies. So firstly, cancer-free, healthier women and girls are more empowered and enabled, and they in turn contribute to healthier families and communities. But also they themselves can then join the workforce with greater productivity. And it is part of tapping the women power and its full potential for the economy and country. Now, part of Prime Minister Modi's Sabka Vikas, Sabka Swasth, I want to also remind everybody, this is what PM Modi's vision of Sabka Saath, Sabka Vikas, and achieving SDGs, the Sustainable United Nations Sustainable Development Goals for India is concerned. A successful abhiyan against cervical cancer is in keeping with Atmanirbhar Nav Bharat, Beti Bachao, Beti Padhao, Nari Shakti, and Swasth Bharat objectives. So there cannot be any of this without Swasth Nariya and Betiyan, isn't it? And eliminating cervical cancer is a low-hanging fruit of health interventions impact that would deliver on both of these. So I wish this series and this initiative all the best in contributing meaningfully to this noble and perfectly doable effort. Thank you.
Thank you so much, ma'am. I was just thinking if we have more bureaucrats like you, I think more than half the problem would be solved. You've put everything in the right, set the tone for it, right perspective. That list of 6 that you gave, I think it's perfect. I mean, those of us who are working in this sector, this is exactly the sequence in which when you're talking of data, you're talking of best practices. I think this is just the package that we would need at the end of all this to take forward. And thank you so much, ma'am, for your time. It's precious that we could hear you today. It is thankful. All of us are thankful on behalf of everyone who is here. Thank you so much. And now we go straight to the topic of today's webinar, which is cervical cancer prevention. But, first things first, who needs to hear of cervical cancer and at what age? They say that it is all women need to hear. And in adolescence, they say you should start. But at that age, do kids take to health messages? So to tell us about how health messages are imparted to adolescents, we have Mrs. Suruchi Gandhi. She's the principal of Bal Bharti Public School, Dwarka, New Delhi, a much awarded educationist and a charismatic academician. Mrs. Gandhi has a teaching experience of 36 years, 15 of which is as principal. She has recently been honored with the National Award for Teachers in 2021 by the Honorable President of India. Her list of achievements are endless, but it reflects in her leadership, which has taken Bal Bharti to global standards. Ma'am, we would like to hear from you what exactly we need to think of when we are imparting health messages like these to adolescents in school. You have to unmute yourself, I think. Can't hear you. Yes, ma'am.
So at the outset, I would like to thank you all for considering me to be fit enough to be a part of this esteemed panel where we have so many bureaucrats, doctors, practitioners, chairpersons of hospitals. I don't think I in no means am a match for them. But since we're talking about adolescent health, I was a little keen on bringing home this issue because adolescence is a very sensitive period of time between 10 to 19 years of age, where rapid growth takes place, whether it is physical or cognitive or psychological. So this is a period of changes, and most of the adolescent problems, I think, are preventable. But we as mothers, as parents, as teachers, as educators, perhaps somehow miss out on these problems, children may undergo depression, they are into substance abuse, alcohol. There are a lot of such issues. And then to some part, our role as educationists is definitely going to be very momentous in dealing with these problems, I feel, because now that life skills is a part of school education, gone are those days of stigma when we never used to talk about certain things, even sexual education for that matter is no longer a taboo. Girls, I think from a very early stage, we impart to children a basic knowledge about their body and how nobody can touch their body without their permission. And of course, the onset of periods and how to maintain hygiene. We have a lot of sessions with Johnson and Johnson and Procter and Gamble and all. And in fact, children are a part of such initiatives where they donate sanitary napkins and they go around spreading this kind of awareness. But largely, I feel that age-appropriate sexual education as part of education is missing in our framework. And we have to be, a little more open-minded and have, a little more openness in terms of debates, discussions, volunteer with youth organizations, government organizations. And I think, of course, education of parents is more important than that of children, because what is like I was hearing the other day that from a very young age, I think if I'm not mistaken, from 9 to 13 years of age, this kind of a vaccine is available and should be taken. So I don't think that many parents or even teachers or even mature people are aware of this, that this should begin before the commencement of any sexual activity. And of course, there are some questions that I have that I'll put forth to the panelists in course of the discussion. But I always feel that not so in big cities, but in villages, the problems of early pregnancy, childbirth, death in adolescents and teens is very common. And even in cities, I would give you a personal example when once I organized a workshop in the school, and it was for 8th class students where we are talking about, contraceptives. And I was pretty amused when a teacher colleague of mine told me that, there were girls who were asking about the use of condoms. So I don't think there is any kind of a, nowadays children are very much aware about things and they have the right perspective to understand and act upon things. So we as educators and parents and teachers and as ladies, and of course, there's another important point that I would not like to miss on is that as ladies, we are largely negligent about our own health because family comes first. We always feel, that we have to do for the family. So priority has to be one with your own self and of course with your children, with your daughters, with your people whom you know. So spreading this kind of awareness, not only talking about obesity in adolescence or not only talking about lack of physical activity or, a child not maybe performing as to the expected standards, but this particular human papilloma virus, which normally, leads to this kind of a thing, how it is preventable, how this cancer is totally preventable. And you see the very word cancer creates that kind of a stigma and fear. I remember when I was young, say about 21, 22 years of age, and I suddenly came to know my mother was suffering from breast cancer. So I almost fainted in the hospital because the word cancer is something that, sends a kind of chill down your spine. So it is now that we learn that this cancer is totally preventable. We had learned about breast cancer, we learned about going for various tests, or getting a routine pap smear or mammography done. But knowing about this vaccine at a very young age, imparting, injecting, because, I am to share with you, it's very interesting that even for COVID vaccination, we are struggling with parents on a day-to-day basis and even telling them that, in case the schools reopen, we would not allow your child to be a part of. All my teachers are vaccinated, all the group D staff is vaccinated. But it is surprising that on an average daily, we are getting about just 7 to 8 children to come forward for this kind of a vaccination. which I think is mandatory for them to attend the school. So we have to tell, and of course, the distinguished doctors are going to talk about it, that what are the repercussions, whether there are any side effects, whether it is safe for young children to undergo this kind of a vaccination, and how important it is as educators and leaders to impart this education to our children. So I will not take any further time because I know there are experts who are waiting to enlighten us about this. So thank you very much once again for allowing me to be a part of this esteemed panel.
Thank you, ma'am. But I would have just add one more question to it that is just asking, since you deal with younger people, that when you take a message like cancer to a child who's say about 12 or 13 years old, how do you think we should start the conversation? Because as you said, there's an imagery of the word,
yes,
which is, it's fatal.
So purpose, Sutapa, should not be to scare them, but purpose is to make them aware of the fact that there are, like any other disease, cancer is a disease, and this kind of a cancer is totally preventable, and I don't know the efficacy rate. Perhaps the doctors will guide me further on this, but the vaccine is very, very effective. And in case you take it, you are free from the risk of developing this at a later stage. So let's not engender that element of fear. But I think our children are mature enough to face facts. They are far more realistic and practical than most of us. And they are far more knowledgeable, as I said. So they will take it in the right perspective, I'm sure.
Okay, so we can go younger. So we can go to them and talk about it, because, many say you scare them. Why are you talking in schools this early? They're not ready for it. So, that's why I wanted to ask you this question, that do we or do we not? Because they need to hear about it. The parents
Absolutely.
need to hear about it. So we
Absolutely.
can. So which I think is great to hear again from an expert who has been in education, that, we can start early. But when we hear of any of this, how much of it do we internalize? How much of it do we apply to our lives? Because you have internet, you have a lot of information. There's too much actually. So how much of it do we take in our lives? Because we do find that people know about a disease, different kinds, but they don't take action. Maybe because they're mothers, they have other priorities, whatever the reason is. But until there's a discomfort in the body, we will not take that step to go to a doctor for any kind of medical attention. That is typically what happens, I think, in most of us. So we need to prepare ourselves with the message. So here I have someone, is one of the brightest person I've met recently, is Poonam Kamdar. Poonam is special in many ways. She's a practicing psychologist. She's a consultant with Times of India, All India Radio and the like, a public speaker, a counselor to cancer survivors, and herself, a fighter who has lived through cervical cancer. She has seen it all, she's experienced it, and she has come out winners. The best part is she talks about it to help other women know more on the issue. Poonam, we would like to hear about your journey, your story. We are all talking of cervical cancer, but you have lived through it. Can we hear your story? Poonam, I think you're on mute.
Yes. Let us face the challenges that life offers you. It's the opportunity to discover the new you. Each struggle makes you strong, and it's a new start. Dear all, live life king size with the dreams in your heart. And yes, believe me, this too shall pass, this too shall pass. Hello and namaskar to everyone, and I extend my heartfelt thanks to ASSOCHAM for making me a part of this education series on cancer. I'm a cervical cancer survivor, one living and that too living fully. My journey from C, that is cancer, to cancer free, it lasted to almost 6 months. I was diagnosed in December 2014, and yes, my treatment went on till June, 6th of June of the next year. So, when I was diagnosed, my body was giving me signals, and I totally ignored it somehow. I was feeling so tired. My irregular flows were there. There was extreme pain in my pelvic region. I felt irritated most of the time. And there was one time in a day that came later on when I was bearing the pain as if I'm going to deliver a baby. And that was lasting every day. At one point of time, I was having that kind of a pain. But still somehow I still did not take any action towards it. And muscle cramps were there. Then later on, when it became almost unbearable, in the sense like I could not tolerate my pain, I went to my parents' place, and then I said to my parents that I want to show to a gynae. And we went there. She said that you have to go in for a small procedure and then only will be able to tell you. Once like the procedure was done, she said the condition is really, really bad and I cannot say anything unless and until I have the biopsy report with me. So you have to go in for a biopsy. So when the report came, it was stage 2 cancer. And I mean, when I received the report, frankly speaking, I was not shocked. Somehow, because I was expecting something, but I was not expecting cancer. So the doctor told me, you don't have, I mean, you have to really move very fast for the treatment part and all. And at that time, I realized I was relaxing and sleeping on it for so long, which I could have really taken, done something about it. I felt myself as if I'm a fool, frankly speaking. But then there was hardly any time to think much about it. So we just planned out the family members and all. And we went to the hospital. We finalized the treatment plan was finalized. I had the surgery, followed by radiation, chemotherapy, and brachytherapy. All these things were there. Now, at that time, I realized one thing, that especially when you were in the hospital and lying down on the bed, the thoughts, they keep on tormenting you somehow, because there's nothing to do over there. You just can't do anything else. So I was asking myself, why you were so, you're so concerned about everyone. Why you ignored your health? Why you did not pay attention to these signs which gradually grew up and became a monster just to grab you? But I was not lamenting, I was not regretting, but then this feeling was there because I saw my family members. I mean, everyone's life came to a standstill somehow, because when a cancer survivor is there, the entire family also suffers. So the caretaker is there, and people whosoever is involved in directly or indirectly, they all are affected. So I felt that not guilty, but then I could have prevented it actually. So that thought kept on coming to my mind, and I said, once I get out of the situation, I'm going to do something about it, so that at least I can create an awareness. I can talk to people wherever it is possible. So now, when let me share my journey regarding the treatment also, where I realized so many other things as well. First of all, I was not in the denial mode. I accepted the situation, and I worked whatever the doctors told me. I had full faith on the doctors. So here again, one lesson that I would like to share. Please talk to your doctors. Go to your doctors if you see a slight change in your body. You are finding certain symptoms. You, as a layman, you cannot identify certain things. But then you go in for a checkup and share it out with your gynae. Maybe you can prevent something very important over there. So that was one thing. Then during the treatment, yes, treatment was not easy. It was difficult, having so many radiation, 28 fractions, cycles of radiations, and then chemotherapy. I mean, it was really difficult. In fact, I was so much filled with apprehensions, fears, and anxiety. I still remember when I went to the doctor's chamber and I asked the question with a very sad face, doctor, I have heard that you're going to inject snake's poison in our body. And the doctor, with a new grim face, he said, do we look like snake charmers? And then we burst out into a laughter, myself and my sister, and we said, oh, ho, ho, ho. And that was one of the lighter moments. But then we were relieved, but again, we could have prevented that part as well. Moving on to the next, this thing, at times when the treatment was going on, yes, somehow I felt that there was cognitive fog at times. I cannot even remember 4 lines that I've read from a book. And I love reading. So I felt so much incompetent at that time that this particular thing is taking a toll on my mental well-being as well. I mean, I'm not able to retain the information, though earlier it was totally different. So I started doubting my capabilities. Whatever I have read somewhere, next day it was over. Like as if my mind became like a tabula rasa, blank slate, absolutely. But anyway, slowly and gradually, I sat down and asked myself, do I want to come out of this situation? This time period gave me a lot of time to reflect upon, to think and think what am I going to do with myself. And then one thought came to my mind, Poonam. See, you have been, motivating so many people throughout your life. In the schools, when you've been interacting with the teachers, parents, and students, and otherwise also. So why can't you motivate yourself? Pick up your thread. Whatever life has to offer to you, fine, it's okay. Accept it with a pinch of salt, but then do your bit. That was the time when I sat and I started working on myself. Slow movements. Each day was like, it was just about survival, nothing more than that. आज का दिन my today's should be over, next day I should see the sunrise for the next day. That's it. So like I started working on myself as per the advice of the doctors. They have told me that you have to do movements slowly, gradually, but start moving. And I did that. It was quite painful, but then a small round of the park, then 2 rounds and 3 rounds at different intervals, and then coming back, relaxing, trying to do the household chores all by myself, little bit, and not to tire myself. There were times, I would like to share here, when I came back from the radiation, after having my radiation, I just entered the kitchen and said, I'm going to make pancakes for all of you. And everyone was saying, oh, she's absolutely fine, good. But after 20-25 minutes, I again sat down and I came back and just relaxed and just went off to sleep. So those were the time and moment. In fact, here I would like to share one more instance. Later on, after my treatment was over, when I went for a support group meeting, and we had a nice dance party and everything and all, and everyone was very happy to meet each other. One of the cancer survivors came to me and she pulled my hair, and I knew what she's trying to see. I said, oh, these are real. Oh, they are real. Menika, yes, this is real. These are real. And you will also have very soft and nice, lustrous hair later on. And she was very, very happy. So these kind of fears that we have in our mind, and when I could help anyone out with that, it really made my day that particular day. So apart from that, if I say that even again, coming back to one thing, yes, prevention is always better than cure. We have been taught in our schools. I remember our teachers telling us, well, a stitch in time saves 9, a stitch in time saves 9, and we've been repeating after her, but never followed, frankly speaking, at least in this case. So what I realized here is that at times when my even taste had absolutely gone, and I could not even smell properly. And in fact, if someone is cooking inside the kitchen and talking, I never liked it. Somehow I had that kind of a thing. Why are they cooking? Why are they talking? Why don't we put a lock in the kitchen? So these kind of, we have our primary sense organs, and if we have to put in the end to certain activities of them, it is something really painful. I could have absolutely prevented that. But by taking care of my body, by taking care of myself and listening to what my body is whispering to me time and again. So these are certain pointers that I really want to share. And again, certain lessons that I want to add upon is, number one, so join a support group if there is a problem. If you're sailing through the boat, if you are having a problem, you are a cancer survivor or a caretaker, join a support group. The hand holding of the doctors really help you a lot. Follow their advice. Don't keep on Googling here and there every time. Take the expert's advice. And you may take a second opinion. That is absolutely fine. But then do not go deep into it, because you are not a specialist in that area. Let the doctors do their bit and trust your doctors. Take care of your diet. Yes, I have changed my lifestyle. Earlier, if I was very much fond of pakoras and puris or whatever, and the road street side food, I try to think twice now before eating anything what is going in my stomach. Morning walks are a must for me. Exercises, Zumba, I enjoy dancing. I enjoy being in the company where people are doing some movements and all. That is life is all about. I think at times that, yes, today I find that the child in me is alive. I keep on writing, I keep on drawing, I attend a lot of art therapy sessions. Then I love cooking. I think at times I feel that why we have 24 hours, why not 48 hours? I mean, each day finishes off so soon and there's so much that is to be done. So life is so beautiful. I believe that strongly. And it's amazing life. And I say hello and hi to it. And to my troubles and to the troubles of the warriors, I say bye-bye to that. Thank you very much.
Thank you. It's so wonderful. Indeed, as Lakshmi ma'am said that, the ginger that to spice it up. You are that for us today. And how beautifully you put it. Yes, you've gone through all the pain, but you've come out winners and you're so happy about it. And you're so nicely presenting it. Well, it has been quite a journey, I'm sure. But then, the best part is that you are here to talk about it and people to see that if you diagnose it early and get treatment, which is a part of the strategy of WHO, that you get yourself treated, you complete the treatment as well. Yes, prevent, surely you can, but then you should complete the treatment, which you did, I think, which is great. And also modified your lifestyle, which could be an example for others to follow. And Poonam, it is really fantastic to have you, and we should have you more and more, hear more and more of your experiences, and more like you, not just you. Other women should follow you, see you, and should come up with their stories. Other women should hear that, yes, we could not prevent it, but we got ourselves treated and we are fine. Because if it's diagnosed early, cancer is curable. So there's absolutely no issues with that. Thank you so much. But that takes us to the core topic of cervical cancer. Why are we talking so much about it? What is it that is in there? As Lakshmi ma'am said that, it's the elimination issue is there, it's preventable. All these things are together. But then what is the disease? With all this that WHO has done, as she said, during the COVID time, it was significant, hugely significant for space in the world and India as well. So if we have to apply the strategies of prevention, we can save lives, yes. But first, we need to understand what is the disease and why is it so scary? What happens in that? So we have Dr. Satinder Kaur to share with us the details of cervical cancer. She's the clinical lead and senior consultant of gynae oncology at the Dharamshila Narayana Super Speciality Hospital, New Delhi, recipient of the prestigious Bharat Jyoti Award for her contribution to the field of women cancers. Dr. Kaur started her career from the Government Medical College in Chandigarh and further trained herself in the newest techniques from the best national and international institutions. Over the decades, she has excelled in her profession and has taken various leadership roles, including being the founder secretary of the Delhi Gynae Forum. Now, who best to put the entire cervical cancer issue into perspective? Dr. Kaur.
Yes. Thank you. At the outset, I'd like to thank ASSOCHAM for having me here. And Dr. Puri has already set the stage and she has given a brief introduction how actually in detail everything needed about the cervical cancer, whatever we needed to hear, she has already set the stage. Yes. And I'm really happy to hear from Mrs. Poonam also how as a survivor she has been really how she has taken up the treatment and she's living her life and she's actually a motivation for many patients. Breast cancer, we all know it's because of the patients that that disease has actually come into limelight and now people are actually getting themselves screened because of it. But there are very few cervical cancer survivors who actually come up and speak about cervical cancer. So, and as expected, so though we are talking about this topic, which is very common, but the first question we had from a participant is what is cervical cancer? So probably we would also like to start from the very beginning. And so Tapa, one thing I would like to differ, as you said, we need to create awareness amongst the women about this thing. I think we need to create more awareness amongst the men about this disease because ours is a male dominated society. So though the upper classes, the females have achieved that level, but still this disease is of the lower socioeconomic group. And so the males have to be educated. And I'm happy to hear this question that we got this question, what is cervical cancer, from a male who is a participant here. And it is good that we need to actually make everybody aware what this disease is. So I'll just start from the very beginning. What is cervical cancer, how it is caused, and then we go for the prevention part of it. So cervix is actually the lowermost part of the uterus. So normally whenever anybody talks about cervical, it's basically the neck. They think about the neck because that's what we have been traditionally been taught. It is that pain in the neck is cervical. And that's what most of the people still think about it. But this cervix is the mouth of the uterus, which is the organ in which the baby is there. Once when the patient conceives, we have the baby is the uterus, and the mouth of the uterus is the cervix. And like cervix, so the cervical cancer is caused by an infection which is called the human papilloma virus infection. So this is one cancer where we know the cause. Since we know the cause, like most of the cancers, we don't know the cause. And this is one cancer, this where we know the cause. Since we know the cause, we know how it gets converted into a cancer, we know how to prevent it and how to treat it early. That is the best thing about this cancer. So once the HPV infection occurs, so HPV infection, human papilloma virus infection occurs to any female who is sexually active. So it doesn't really, even if you are in a single partner relationship, you are going to get human papilloma virus infection within 3 years of onset of sexual activity. And in majority of the cases, it gets treated on its own. You do not need any treatment for this infection. But if there are some risk factors, like if you have multiple sexual partners, if you have coexisting other infections, if you have chronic smoking, you started your sexual activity at a very early life, then these all are risk factor for cervical cancer. So in all these cases, this HPV infection might get converted into a precancerous stage and then into a cancer stage. But this whole process of a viral infection getting converted into a cancer takes around 10 to 15 years. So we have this window of opportunity of 10 to 15 years where we can actually detect this viral infection or any precancerous changes or any cancer changes which have occurred in the female. So actually we have this big long time in which this cancer can be detected early. So that is why we talk about this prevention and screening for this cancer. And then again, since we know that the cause, we know that this cancer is caused by HPV infection, we have a vaccination for this virus, which with the help of which vaccination we can prevent this disease. So, and we have already talked what is the incidence, how severe is the disease. As you said, 1 in 8 women in India and 2 women in the world. Globally, we can say every 2 minutes, 1 woman is being diagnosed with cervical cancer all over the world. And 90% of these cases are from low and middle income countries. India alone, we know, contributes a lot, more than 3 lakh cases, more than 80,000 deaths in India occurring every year because of this cancer. So how do we need to prevent it? So the prevention can occur at various levels. One is the primary prevention, that is in the children, and that is by vaccination. So we have 3 vaccines available. One is the Cervarix, one is the Gardasil. So to begin with, HPV there are around 100 types of HPV, but there are 14 main types which cause the cancer. And out of these, there are 2 main types, which is 16 and 18, which cause 70% of the cervical cancer. So the major vaccines, the Cervarix and Gardasil, both are against type 16 and 18. So the effect against this for prevention of cervical cancer of both these vaccines is same. The Cervarix and Gardasil 4, which was previously available. So effect against cancer is more than 90%. Efficacy, as Madam Saruchi was asking, what is the efficacy of this vaccine? It is more than 90%, but this more than 90% is against preventing this 70% of the cancers caused by 16 and 18. So there are other 30% still left for which screening is must. So in spite of getting vaccination, you still have to get yourself screened because there is still 30% chance that you can get infection from other cancer causing viruses. Another new vaccine which has come up is the Gardasil 9. It contains, along with 1618, another 7 types which lead to 85% of the cervical cancer. So the protection rate of Gardasil 9 is definitely better than Gardasil 4 and Cervarix, but the vaccine is quite expensive. So as of now, including it for public in public life, I think it will be very difficult. But because in India the cost is around 11,000 per dose for the vaccine, so it will be maybe a little difficult. But once the government sector is involved, probably we'll get some help. The dosages, as we said, the indicated age is 9 to 45 years of age. So 9 to 14 years of age, you need only 2 doses. From 15 to 45 years of age, 3 doses of vaccine are needed. 15 to 26 is the catch-up period because the vaccine best efficacy is before the onset of sexual activity. So if you have taken vaccine before the onset of sexual activity, the results are very good, as indicated, more than 90% survival. But if you're already sexually active and you still want to take the vaccine, you can take it, though the efficacy will be slightly lesser than in people who have not been sexually active. So that it still protects you. So even if you have been infected with one type of HPV, you can still take the vaccine because it is going to protect you against the other types. Now, this is about the vaccination. Next is screening. So screening, conventionally, we have been using the method for screening is pap smear or the cytology. So the cytology is an easily available method. The pap smear, it is very easy to be done, a painless procedure. It takes hardly 2 minutes. You can go to any hospital, any gynecologist, any nursing home. It is easily available everywhere. It is very painless. The main problem the females are worried about is that it is very painful. They don't want to go. They're reluctant in getting a pap smear because yes, it's a private organ and nobody wants actually to get it checked. But yes, it is very important. And most of the times, females have this feeling that I'm absolutely fine. Why should I go to the doctor? Why should I get myself screened? So I want to say that screening is only if you are absolutely fine. If you are not fine, then you need treatment. If you are fine, then you need screening. So if you're absolutely fine, please go to the doctor and get a pap smear done if you're sexually active. So the screening starts from the age of 21 years or 3 years after the onset of sexual activity, whichever is earlier. With the pap smear, you need to get yourself screened once in every 3 years. And the screening can be stopped by the age of 65 years if your previous 3 tests have been normal. But in Indian scenario, we get in our daily OPDs, we get females who are 70 but have never got a pap smear done. So in these cases, we should do their pap smear because the age of stopping of 65 is for females whose previous 3 tests have been normal. That means last 10 years they have been absolutely fine. So in our country, that scenario usually doesn't occur. So we actually need to screen that. Sorry. Now cytology, the next test which has come up very important is HPV testing. Now we can also test for the pap smear, basically test for the changes which have occurred in the cervix because of the infection, and it tests the precancerous condition. But we can detect at the first step, we can do the HPV testing also. HPV testing directly tests for the virus. The procedure for taking the sample for HPV testing is same as that of the pap smear, but it is slightly expensive, and that is why it is not easily available in all the places. But if you have the facility, you should go for a co-testing with HPV and pap smear both. If you do not have the facility for HPV co-testing along with pap smear, which needs to be done once in 5 years, and you have facility only for HPV, go only for HPV once in 5 years. If you do not have facility for HPV, go in for a pap smear, which can be done once in 3 years. But there are other areas in our country as well in other low middle income countries where facilities for both PAP and HPV are not available. So in those places, so there is another test which is called visual inspection after applying acetic acid. So acetic acid is a common vinegar which we use in our household setting. So it is easily available, though it has to be freshly prepared and 3% acetic acid to be used. So this test, even you don't need a doctor for doing a visual inspection with acetic acid. Even ANMs, nursing officers, your people can be trained who can undergo this process of visual inspection with acetic acid. There's a very small training can be given to these people, and they become very good in doing all these things. And so VIA is an option in countries, in places, in our country also, in places where it is not available. And if you know that patient is not going to come back to you, you have gone to a small village and you have done a VI, you know patient is not going to come, you can treat the patient at then and there, which is called the see and treat approach by WHO, and it is being widely practiced in our country. So for screening, you have a pap smear once in every 3 years, HPV and pap co-testing once in 5 years, or HPV alone once in 5 years, or VIA once in 3 years. And now, as per the the strategy, global strategy which the WHO has laid, which Madam Puri had already said, we say that at least you should be tested by a high efficiency test once by 35 years of age and then once by 45 years of age. So our aim is that at least 70% of the females are screened by this method. And the next thing in prevention is the tertiary prevention, which is the treatment. And we aim that all the patients, we wish, as per the strategy, we wish that 90% of the females should be screened when in their precancerous or in the cancerous stages. So treatment facility. In our countries, still the availability of cancer treatment is there in hardly 30% of the 30% of the population has access to cancer care treatment, and majority of this is still in the private sector. In the government sector, it is very less. Very few places have radiation oncology machine, have cancer specialists, and in fact the patients are being treated wrongly, which leads to spread of the disease. And we see day in and out, we see the cases which have been mismanaged, which is actually leading to bad prognosis of disease, which is an easily preventable condition. And we are really happy that first time WHO has taken this initiative, and everybody has come together to actually eliminate this cancer. And we are aiming that if we are able to achieve this goal of 90, 70, 90 by 2030, we might be able to eliminate cervical cancer by 2021. And another important thing which has come up is the COVID. But I think it is a blessing in disguise, which since we have Dr. Madam Puri here and everybody, see now RT-PCR test is available everywhere because of the COVID facility available. HPV testing was not done earlier because we did not have facility for RT-PCR. Since we have now RT-PCR machines everywhere, this can be used for testing HPV. The same machine. So the facility is available everywhere. So why it cannot be used now? When it can be used for COVID, it can be used for HPV. These machines are going to go waste once the COVID is over. So we might actually use it for cervical cancer screening, which it will be a blessing in disguise for us. Second important thing, vaccination. COVID vaccine. We don't know the long-term results of COVID vaccine. Still, everybody is taking it. With government's initiative, government's help, we have been able to vaccinate so many people. So why not for cervical cancer vaccine, which is available since 2006? We know the long-term results. We know there are no side effects. We know how helpful it is. Australia has brought down their results of their cervical cancer rates to one of those elimination levels just by vaccination and screening with pap smear and vaccination. And if there is a mass vaccination like for COVID, for cervical cancer also, probably we'll be able to eliminate cervical cancer much earlier than even the global strategy planned by WHO if we use this opportunity of COVID for preventing cervical cancer. Probably that's my take on it. I'm happy to take any questions, whatever comes next.
Sure. Any questions coming in, please put it on the chat. We'll take it at the end. And it's so beautifully you put it, I think you've covered almost every point. And as you said that, use the blessing that COVID has given us, not think only the negative that COVID has given, because another thing is that with virus, people have now understood with virus, you have to have a vaccine. Yeah. You cannot treat it. So you prevent it. So, which is also when we do community level work, that's what we find is easy to pitch it now, to anybody. And we also do community level screening. We've been doing it for many years. When we go for screening, one thing that happens with women, we talk of everything that, there's no problem, no pain, everything, all. But they say, if I go to the screening center, I'll be diagnosed of cancer. That's another fear that they have. They will not walk in. The fear that, oh no, I will be getting cancer. So, there are a lot of these things, as I always say, that the imagery around cancer has to be changed. The image of cervical cancer has to change. It's preventable. People just don't understand that you can actually prevent a cancer. They say, oh, jab hoga, tab hoga. We will see. Now, cancer is a very different kind of a disease, unlike any other disease. So I think it has to be dealt with differently. Thank you very much, ma'am. I mean, I will have questions at the end. So I'll think of those questions for you. And before that, I'll go to testing, the screening, as you're talking of screening. A lot has happened, it used to be test centered. I think now it is women centered. How do you make it simpler? How do you make it easier? So the samples could be collected well, tested, quickly you can give the reports. So to make it as convenient for a woman. And I think that is the main focus for us, that we are moving towards a world without cervical cancer. Two powerful tools: cervical cancer screening and vaccination. But we have to think that first, let's talk of the mothers, the adult women who have to get themselves screened. So we'll first get to that. And to discuss that, we have Dr. Kirti Chadha. She's a Chief Scientific Officer and Senior Consultant Oncopathologist at the Metropolis Healthcare Limited in Mumbai. A gold medalist from AFMC Pune, Dr. Chadha has over 2 decades of experience where she has made exceptional contribution in medical diagnostics in India. She has introduced pioneering concepts in oncopathology in the country and continues to innovate in making diagnostic effective and accurate. A WHO expert for medical devices, she's a celebrated orator and an advisory board member of the Indian Cancer Society, among many other associations. Ma'am, it will be an honor for us to hear from you as to what are we thinking when we talk of HPV testing for screening.
Thank you. Thank you so much. And it's a very emotional and a very, practical moment right now, because, ever since I started becoming a doctor during my training in the armed forces, my thesis was on CS cervix, And now, after 2 decades, to sit with such an esteemed, faculty, and to see everybody coming together. They say that when you really want something, all the forces of nature work towards it. And this has been so frustrating, I think, for all of us over these years, that something is preventable, something is doable, but nobody does it. And you will not believe it, all of us are guilty. I mean, I stand guilty. How many times have I done a pap smear? And, I always ask that question whenever I take a talk, and I ask people that, have you actually done a pap smear? You're giving gyan to everybody. Have you done it? So, we're all guilty. So I think all the people before me have spoken so well. And first, I would just like to, just reiterate all of that, because everything is so important, right? So the WHO stand is very important, because when WHO, narrative goes out and everybody takes cognizance, people are a little more attentive. So, I think it's going to really help. And when you put a deadline to something, there is a competition to achieve it before the deadline, by all the stakeholders. So I'm happy, that has happened. And also very happy to hear, Madam Puri and, Dr. Kaur. I think amazing inputs, and hats off to our survivor, and, really hats off to you. You're just amazing. So I think very well touched upon. If we are not going to do it now, as Dr. Satinder said, when everybody has studied from the WhatsApp University and Google University and become an expert on diagnostics, if I may say, till 2 years back, nobody had a clue what is quality control, what is PCR, what is ICMR, and what is POC testing, and what do you mean by sensitivity, specificity. I had to bang my head sometimes, when I used to talk about conventional pap smear, liquid pap smear, and the various HPV, and now it's like people are teaching us, and I'm like, oh, okay, good. Now you know everything. Now go ahead and do it. So still, I would like to, for the benefit of the audience, just like to recapitulate the entire journey of cervical cancer screening. So I always believe, as our principal said, that, the young know it all. I mean, they're so sharp. I learn every day. I have 2 daughters, one 14 and one 10, and they know it all. And my 14-year-old girl is vaccinated for HPV. And when I told her, she said, Mom, there's something like that available. Let's just go take the vaccine. She was not scared, as, she rightly said. She was not scared at all. And she was like, I don't know what's going to happen tomorrow. I might as well take the vaccine if something is available. Now she's even taken her COVID shot. So these kids are smart, right? So there is no doubt about it. And our elders were also smart. Now it's how smart are we? I think it's our time to deliver. So, I always feel you have to learn from your, seniors and elders, and you have to also learn from your young. And then you have to deliver if you're in that position. You're in a position of power to deliver. So we cannot, proceed this conversation without, thanking 2 people, Zurhausen, who actually discovered that HPV causes cancer, right? As, so many people said, and how many cancers do we know what's the reason? But here we know what's the reason. And that's because of one person, Zurhausen, who connected HPV to cancer. The second person is Papa Nicolau himself. So pap smear has stood the test of time, and for the last 20 years that we've been, at least I've been using it, and I cannot tell you of how many women have got detected, have got treated. So it is, and it's very interesting to know that he actually tried it on his wife, right? So he used to take her sample. I don't know how many people are aware of this. So, Mrs. Papanicolaou has a bigger contribution to this. Somebody mentioned the importance of spouse. So yes, nothing is possible in this world without support of your spouse and, your family. And, there were two things that really helped Papanicolaou. One was that, how would he study this association? So he actually took his own wife sample at different time intervals to see what happens to those cells. And then how do they change, shape and, size, and how do you detect that, okay, now this is, precancerous. And the second thing that helped was collaboration, what we all touched upon, that until you collaborate, you cannot live in a silo and hope to do anything, right? So collaboration is the key. And when he started collaborating with gynecologists and understanding, oh, it is at this stage where you can intervene, where you can treat, where you can, help someone, that is how, this whole journey progressed. So when we talk about cervical cancer screening, definitely the first test, which has stood its test of time for 50, 60 years now, is the pap smear, definitely. But let us understand what has happened. Pap smear is a wonderful test. I'm a cytopathologist, so, I love the test. But, I also know what goes wrong, right? I also know what goes wrong. So 2-3 things go wrong. First of all, you need experts to read those slides. Now, experts are not available everywhere. And if we want to do something in a mass level, we are not going to get so much resources or manpower, right? So the next best thing was to do a liquid-based cytology approach. So the whole conventional pap smear went into liquid-based cytology, and that definitely helped us. And we have an international publication, in fact, on this, on huge number of women. And the number of cases that we could detect by LVC would double, just simply double of conventional pap smear. That is the way the sensitivity increased. Now let's talk about HPV. So at least till now, whether it was the American societies, whether it was the US Preventive Services Task Force, or whoever it was, everybody said that it is better to do a co-test, HPV as well as a pap smear. And if you do a co-test, you can get away with doing the test every 5 years only. We know compliance is an issue. We all know. So, and also how many times is the, the manpower going to go and, sort of take all these samples? So the whole journey of co-test started, and it definitely improved compliance. I have seen many, many more people now do screening, because now they don't have to see, earlier pap smear used to run every year. Then it became you have to do cytology only 3 years. Then it became if you couple a HPV with a cytology, you have to do it only 5 years. So we kept on increasing the duration of the screening, and we kept on increasing the sensitivity and the specificity of the screening, and we started achieving good results. But there's a plateau, right? We are still losing women. So, you are lucky, you're a survivor, but trust me, till today, I sign out at least 1 to 2 cervical cancer cases every day. And half the women are not so lucky. They are in stage 4 by the time we diagnose them. And we all know that the survival in stage 4 is, not even. So the survival is between 36 to 60%, what is published, and 46 is an average. So that means that each and every cervical cancer patient, diagnosed, we are going to lose nearly half of them as we stand today. And that is a very, very dismal number, and it's something that India is not at all proud of, should not be proud of. So what should we do about it? So as correctly said, the best way to do is obviously is to, follow the global strategy, try and vaccinate as much of our girls as we can, and try and screen as many of the women as we can between 30 and 65 years of age. And whoever we catch, we should treat them. Now, what is the watershed moment in screening actually? And what is the whole debate and the whole confusion about today? That is that the whole mindset or the whole wave is changing from making high-risk HPV as the primary screening. Now, that is a big, big, big change, right? And trust me, people are not even ready for this change, in the sense, not in terms of technology and infra. Ready, I mean in that way, right? So if that is what has happened, then we all have to get ready. Now, what does it mean, right? So it means that, see, till today, I mean, 2001, say we have a, hybrid capture test, which has been approved by FDA, and there are many kits which are FDA approved for HPV testing. But not all of them are approved for primary screening, right? So I would really try to take this cue from what Dr. Satinder Kaur said, actually. Very, very good point. That today, the amount of infra that is developed for COVID, okay, there are so many molecular labs that have mushroomed. So I was in a conference in Haryana 2 months back, and I was shocked to know I was interacting with the Deputy Director, General Health Services, and she was, telling me how each of their government labs now has a molecular unit, shaping up. I mean, that's amazing to know that, that there are so many, and we all know the ICMR data and the number of labs and the number of accredited labs. So first of all, there were labs, but they were not accredited. Then even if they were accredited, they were not, sometimes not, on the same page as far as the kits are concerned. So today there is a, it's all very synchronous, right? So everything is controlled. There is a certain degree of control that these are the kits which should be used. These are the acceptable sensitivity. There is an acceptable specificity. So many people have got trained. Today, the number of molecular biologists and the number of microbiologists, they are booming. They have got trained virologists. Today, we have virologists. Now, Metropolis itself is opening another center of excellence for virology in Africa, because we felt that, it's not. So we as we all know, Africa has a very, very high number of these cases. And we used to get a lot of samples from them. But during the COVID, scenario, we realized that logistics is a big issue. And, all our people who we collaborate with over there, very, very senior doctors, government officials, they told us this is not working out. We can't even get the samples to you. And our patients are losing out. And we realized, okay, we need to invest. We need to make a center of excellence in Africa itself. So what I'm trying to say is that today there are multiple centers of excellence of virology shaping up across the world. And if that is going to help anything after this damn COVID is out of our life, it's going to help the cervical cancer, right? Because, I mean, obviously now with Omicron, it's such a puny variant of the, corona. And I think it's the best way to get out of the pandemic unless we have another surprise by a virulent strain. So, the whole thing is that now it's going away. It's tortured us for 2 years. But I think it's going to leave, some very key things that were missing to actually combat cervical cancer. What was missing was the infra, the focus on health, the quality, the people, the manpower, the follow-up. Digitization is what was missing. Today, digitization is rampant, and that is going to help us like anything. Artificial intelligence. So even the VIA technology, that ma'am mentioned, that, doctor is not even required, but still you're dependent on the the basic intelligence or, the experience of the person who's seeing it. But today there are AI algorithms and you can put all the pictures together and you can actually say which one is what. So, all this AI and, digitization and automation that has got developed for COVID, I think is going to help many, 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 other diseases. Not only cervical cancer, it's going to help many diseases. So I think now the writing on the wall is very clear that we all have to arrive at a primary screening HPV test, which can be offered at a mass level. And another thing that is very important is the self-sampling, right? So today the data of COVID is all over the place because nobody knows the real data because of the rat, right? So earlier everybody with huge diligence was getting everything done in a proper RT-PCR from a lab. But today everybody's become very smart. I mean, everybody's picked up, all the rapid antigen kits. They have a whole lot of them in their house. Oh, you thinking you're positive? Okay. Oh, you went out? Oh, my maid, oh, my this, tuck. And before I know it, everybody is like, okay, this is positive, this is control. I'm like, also what is the meaning of control? What is lateral flow? But it is such an exciting moment, right? So it's good. So it's good that so many people are now aware of this. And I think self-sampling is the way to go. Women are shy, women don't have time, women don't focus on their own health. Even if they do, they have to go with somebody. Some people are still dependent. Everybody is not so privileged like most of us in the metropolitan and cosmopolitan cities. And as one of the panelists mentioned, this is a cancer which is unfortunately more common in the lower strata of society, whether it's because of their immunity, hygiene, multiple other factors, or just ignorance, or no money, no time, lots of things. So I think when we're going to couple self-sampling with a good primary screening of HPV, we are definitely going to catch, more women. The only doubt that, people have, And, College of American Pathologists has also highlighted this area, which we all know, that even though HPV screening has got an excellent negative predictive value and excellent sensitivity, it is poor in specificity and in the positive predictive value. And there is where the importance of triaging is going to come. Now, how are you going to triage it, right? So either you see HPV prevalence, when we looked at it in thousands of our cases, we found across 9% prevalence. So 9% people are but not CA cervix positive, right? So there are a whole lot of people who are going to be HPV positive because, as somebody said, it's very, very common in the sexually active age group. So even though they are going to be HPV positive, they're really not going to have anything to treat because there is going to be no lesion. And that actually can only be seen by cytology or by colposcopy. So again, you will have to develop that triaging and that reflex, and that where you are able to then, from the HPV positive women, identify the women through colposcopy or through cytology who actually need what treatment they do need, for that particular stage in which they have got caught, because there is a huge time period in which they get caught. So, because every time the treatment is not so aggressive, right? So it varies from your, different modalities, which I think will be covered by another speaker. So I'll not go there. So, but basically that's what it is. So let's welcome this era where we are going to start active primary screening by HPV, and hope to, link it with tests which help us to actually identify the women who need treatment and what treatment, do they need. So, yeah, so thank you.
Yeah. Thank you so much. You put it so well. And when we have thought that we have heard everything about cervical cancer, everything about HPV, that's when Nilima ma'am comes. That's the point because they are the ones who have the vaccines with them. So what is happening new in the vaccine space? Because we all realize that HPV is the way to go. Either it's testing or it's vaccination. So for that, we have Dr. Nilima Dwivedi with us, the Executive Director, Public Policy, Corporate Communications and Market Access in MSD India. 25 years in the corporate sector, Dr. Dwivedi has held senior positions in DuPont, Monsanto, PepsiCo, Microsoft, and of course, MSD. She has a remarkable talent in cultivating relationships across stakeholder groups, including the government at national and state levels. She is a leader in her own right and extremely committed to issues of women's health in India. Over to Dr. Dwivedi, that what is new and what more, what have we left we haven't touched upon in this past 1 hour?
Sure. Thank you, Sutapa, and thank you, ASSOCHAM, for having me be here. What a great discussion. In fact, all our previous speakers, I think, and most of the points have already been touched and touched in the best of manner. In fact, I would just start with Madam Puri, and she started with the Globocon report, and 90 was repeated so many times. So as such, there is nothing left, frankly speaking. I think even on vaccine, it has been touched so nicely. It has been touched upon, and our two experts, doctors, they have really Madam talked about comprehensive. It was quite comprehensively discussed by the previous speakers. And what a day to really have this session. Today, it is being celebrated and observed as a National Girl Child Day, and we are here. We have a topic of the girl child, the adolescent girl, and how we can really prevent. And prevention is better than cure. It has always. Again, I am just repeating. But keeping that in mind, and in prevention, if we talked about the three types, right, the three stages, which is primary prevention through vaccination, secondary, of course, screening, and the third one is the treatment, right, treatment of whether it is invasive treatment or treatment of the lesions. So I wouldn't repeat a few of the data which I had in mind, especially the Globocon, which has estimated 6 lakhs women globally, right, are being diagnosed, and out of that, or more than 3 lakhs women lose their battle because of this disease. And this is one such cancer which is preventable. So keeping that in mind, that if this cancer which is preventable, how can we really reduce this through these various preventive measures, such as especially vaccinations and screening. Even if you look at the Indian data, and anyway, India has 20% of its population, of global population. So similarly, the cancer burden also is almost quite high. The data is really alarming: 1.7 lakh cases annually, and out of that, almost 100,000, 97,000 approximate. In fact, women are being diagnosed with cervical cancer, and more than 60,000 are losing their battle because of this disease every year. So, of course, this is one of the second most prevalent cancer, and everybody has talked about it. So keeping these things in mind, of course, HPV vaccine is really the cornerstone for the long-term cervical cancer control. So many studies have confirmed about its safety, efficacy, and its cost effectiveness. So again, I wouldn't go there. Our doctors have already talked about it. And WHO strategy for 90, 70, 90. So I just want to reiterate that if we have to really contribute towards that, towards the commitment which WHO has made, and we really want to eliminate cervical cancer from this globe, I think we all have to really follow this strategy of 90, 70, 90 as a country, right? And here it's not only about us, it's about we as a whole, as a society, right? That how we really eliminate it and take on as a challenge to eliminate by 2030. So coming back on HPV vaccination, because that is one of the questions which Tapa asked. So there are three types of vaccines available currently in the market. The first one is bivalent vaccine, which of course gives us protection against two major serotypes of HPV. The second one is the quadrivalent vaccine, which again gives us a major protection. It's little broader than the bivalent, of course, and which gives us protection against the four major serotypes, which causes cervical cancer as well as the vulvar and all. And the third one, which is the latest one, is the nanovalent. So the nanovalent vaccine is really the critical development, and this is a gender neutral vaccine. So I wanted to reiterate and really wanted to share about this, and we have launched, and this is launched in India now. DCGI has approved, and recently it has been launched, and it is very well available now in the country. So this gender neutral vaccine is really going to be a game changer, where it will reduce the disease burden of HPV related cancer in India. The 9-valent human papilloma virus, in fact, so these serotypes are 6, 11, 16, 18, 31, 33, 45, 52, and 58. So it gives protection against all these major 9 serotypes, which mostly causes, in fact, not only cervical cancer, but various other cancer, like cancer for vagina, vulvar cancer, and many other cancers, not only for the girls, but also for the boys. And this vaccine is approved for 9 to 26. Between 9 to 6, it can be given to the women and girls, and also for boys between 9 to 15 in India. So keeping these things in mind, and in fact, one of the data I wanted to just quote, which is of World Population Prospect, the population database of United Nations, where if you look at India, again, world's highest number of this cohort is lying in India, which is 10 to 24 years old. Almost 230 million, in fact, girls and women, you can say, they come under this cohort of 10 to 24. And of course, 20% of the world total population. So keeping these things in mind, I think it is really very, very important that we are going to be the youngest population by 2030. So health, disease prevention remains really a priority for this segment. And in fact, our previous speaker talked about how we can really leverage now the lessons what we have learned from COVID, right? Whether it is through RT-PCR or even the taboo, the hesitancy, vaccine hesitancy what we had. And Government of India has really done a fabulous job in this. Other countries are struggling even today for vaccination, whereas the coverage in India has really uh, has gone up, and it's quite high. So I think similarly, as per WHO strategy, so many countries have part of its national immunization program. India is yet to have that. There was an announcement. I am sure slowly India will really also prioritize this. But yes, national immunization program is way to go. And in addition to that, of course, now we have 3 vaccines available. There is a vaccine available for which is gender neutral, which also gives, when we talk about women equality, when we talk about, I think it's also being equal and being responsible towards our women, towards our girls, or towards our partners, right? So keeping that responsibility, I would also encourage boys to go ahead, and this is very much recommended, that it is, and in other countries it is being given to boys. Somebody talked about Australia. I remember that Australia has where even the quadrivalent was being given to the boys. So I wouldn't go much into detail. 9 serotype we have already talked about. I think somebody was talking about the efficacy for 9-valent. It has been quoted 98.3%, in fact, efficacy for cervical cancer, 95% for vulvar cancer, 77% efficacy towards vaginal cancer cases, and 70% efficacy towards anal cancer cases in India. So yes, we all have to come together, work together. This is a great platform. And as per WHO's recommendation, routine HPV vaccination should be included in national immunization program. And with this, of course, this 90-70-30, 90-70-90 is the mantra which we all have to follow. That's the target. And with this, of course, I just want to say that the WHO mission of global elimination of cervical cancer by 2030 can only be achieved through these preventive measures, where HPV vaccine is really going to play one of the most critical role. Thank you for
Thank you so much. I completely agree with you. I think the entire panel agrees with you that the strategy is in place and we just have to follow it. You know, the best part is that when you have such an enlightened panel and so motivated, that all the questions on the chat box have been answered already, right? So Dr. Kaur was religiously, she picked every question, answered clearly. Again, there was any extra question she has just answered. So I don't have any question to pick from there. If you have any more questions, maybe in some other webinar, we'll pick it. So I would request Poonam has to come in now, give the final message to all women who are listening to this session before we close. You are mute, Poonam.
Okay, just a second.
Yes. Okay, it's fine.
The house, to take care of your family, you need your physical and emotional energy, and you have to learn to put yourself first, because if you are healthy, I think the entire family can get those positive vibes. So do not delay your care. See, face your fears, because if you have any apprehensions, face it by going in for the screening, because prevention is always better than cure. And why do worry? I mean, if there is nothing, it's absolutely good enough. I mean, you have got a clean chit. But if there is something that has been found, then you can go in for the treatment. So earlier it is identified, better are the chances of recovery as well. So my message to all the ladies is that please fix an appointment with your gynecologist and do not delay your screening, because you can do a lot of changes. You can do a lot of things which are important for you. And take my words once again that if you are diagnosed, still the treatment part is there. why unnecessary wait for something to happen? Let us be at the peace of mind, right? So that is the only thing that I would like to say, and that's it.
I
Well,
just
thank you
wanted
for
to add here,
yes,
just by my last word,
yes, ma'am.
that HPV does not discriminate between males and females. So just like, we need to really keep that in mind, right? Most of the transmission happens through males, right? So it doesn't discriminate. So yes, there is immense value of a gender neutral HPV vaccine, and also the shared responsibility of reducing HPV related cancer and disease burden. So we can collectively do, though of course this panel might be like no women, and most of us are like from all the women are there in the panel, but the message is out for everybody. I think it's a general neutral where we all have our roles to play.
Sure, ma'am. And this, interestingly, this is actually on both sides of communicable and non-communicable, this particular disease. It plays between both, so it needs to be covered more. So, which I think on that positive note, I would like to thank each one of you for being with us today. I'm sure you're taking back valuable information to keep cervical cancer away from your life. A special thanks to all the eminent speakers for your insight, and to ASSOCHAM and their entire team for making this possible. Have a great evening, and over to you, Pasnaji.
Thank you so much. And I am really thankful to ASSOCHAM as well as all my actually very knowledgeable speakers. And I am impressed with the survivor, Poonamji. She is very brave and we should learn from her. And my doctors are really good. And what I want to take from home message from this, that I am going to prepare a proposal for government of India that now these RT-PCR machines are available. So kind on mass level, we should start this, testing of cervical cancer, and as well as we should start vaccination for that. So, I am representing actually AHPI, Association for Healthcare Providers of India. So I will make a proposal and I will approach to our health minister, because female health is very important, as everybody knows that if a lady is healthy, she can make whole family healthy, and she is going to deliver a healthy child who is going to make a healthy nation. So we need to focus more on female health. So for this, I am really thankful to all my speakers. A special thanks to Lakshmi Puri ji. She accepted our invitation, and she has a very vast experience in UN also. So with all these words, I am saying bye to everyone. But same time, we are going to meet again for some next series. Thanks a lot. Bye-bye.
Thank you, everyone.
Thank you.
Thank you, everyone. Thank you. Bye.
Thank you.